Hello everyone. Today we'll discuss the part 49 of the NEET quiz important questions, and today we'll discuss the questions of the topic stomach. So first try to answer the questions by yourself. Which is the most dilated part of the digestive tube? So it is stomach. Gastrin is a hormone which is secreted by stomach. What is the capacity of the stomach in the adults? So it is about 1 to 1.5 liters. What is the capacity of the stomach in the newborns? So it is about 100 to 200 ml. What is the location of the stomach? So it is present in the epigastrium, left hypochondrium and the umbilical region. What is the volume of the fundic air in the empty stomach? So it is about 50 ml. What is the location of the cardiac orifice of the stomach? So the location of the cardiac orifice of the stomach is at the T11 vertebral level, about 40 centimeters from the upper central incision, and 1 inch left to the median plane behind the 7th costal cartilage. At which vertebral level the pyloric orifice of the stomach is located? So at the L1 vertebral level, the pyloric orifice of the stomach is located. What are the peculiarities of the pyloric sphincter? So pyloric sphincter is related to the pre-pyloric vein of Mayo. The bile is stained after death over here and it remains open in the empty stomach. So pyloric sphincter remains open in the empty stomach. Pylorus is related anteriorly to which structures? Quadrate lobe of the liver. Pylorus is related posteriorly to which structures? Lesser sac and the neck of pancreas. What are the difference between the lesser and the greater curvature? So lesser curvature is more fixed than the greater curvature and the lesser curvature is more posterior than the greater curvature. What is the location of the incisura angularis? So incisura angularis is located in the transpyloric plane. Lesser curvature has anastomosis between right and the left gastric arteries. The greater curvature has anastomosis between the right and the left gastroepiploic artery. Pyloric antrum is a bulge seen at which curvature? So it is seen at greater curvature. Fundus of the stomach reaches up to which intercostal space? So it reaches up to left 5th intercostal space. Which ligament is attached at the cardiac end of the stomach? So gastrophrenic ligament is attached at the cardiac end of the stomach. Gastrophrenic ligament. Which ligament is attached at the fundus of the stomach? So it is gastrosplenic ligament. So ligament attached at the cardiac end of the stomach, it is the gastrophrenic ligament, and the ligament attached at the fundus of the stomach, it is the gastrosplenic ligament. Anterior surface of the stomach is related to which structures? So anterior surface of the stomach is related to greater sac, diaphragm, quadrate and the left lobe of the liver. Gastric triangle is on which surface of the stomach? So it is on the anterior surface of the stomach. What are the boundaries of the gastric triangle of the stomach? So the right boundary is formed by the inferior border of the liver, left by the left costal margin and the inferior by the transverse colon. So these all structure are the boundaries of the gastric triangle of the stomach. Now describe the Traube space. The Traube space is over the fundus of the stomach and it is tympanic on percussion. It is obliterated by the splenomegaly or hepatomegaly or pleural effusion. Traube space is bounded by superiorly it is bounded by the inferior border of the left lung, on the right by the inferior border of the left lobe of liver and to the left by the lateral end of the spleen. Which structures form the stomach bed? So left crus of diaphragm, left suprarenal gland, left kidney, splenic artery, spleen, pancreas, transverse mesocolon, and the splenic flexure of the colon forms the stomach bed. Which viscera that form the stomach bed is not separated by the lesser sac? So it is the spleen. Venous drainage of the stomach is right and the left gastric vein, which drains further into portal vein. Short gastric and the left gastroepiploic vein, which further drains into the splenic vein, and the right gastroepiploic vein, which further drains into the superior mesenteric vein. The sympathetic nerve supply to the stomach comes from which spinal segment? So it comes from T6 to T9 spinal segment. Describe the nerve of Latarjet. The nerve of Latarjet is the main gastric branch of the anterior vagal trunk, and it runs at the lesser curvature and supplies the anterior surface except for the pylorus. The terminal branches supply the pyloric antrum. Now describe the nerve of Gracie. The nerve of Gracie is a branch from the posterior vagal trunk, and it arises at the gastroesophageal junction. It supplies the fundus of the stomach. Right vagus in the neck becomes what in the abdomen? So right vagus in the neck becomes posterior vagus in the abdomen. Lesser omentum is attached to which visceras? So it is attached to the lesser curvature of the stomach and the first part of duodenum and liver. Free margin of the lesser omentum contains what? It contains hepatic artery proper, hepatic plexus or sympathetic plexus, common bile duct, and the portal vein. Lesser omentum has which ligament? It has hepatogastric ligament. It has hepatoduodenal part also over here. Lesser omentum develops from posterior part of the ventral mesogastrium. Lesser omentum at the lesser curvature contains what? It contains the right and the left gastric vessels, gastric branches of the vagus nerve, and the lymph nodes. Which is the largest peritoneal fold? It is the greater omentum. Greater omentum has 4 layers. The second and the third layer are actually continuous, okay, and they are derived from the lesser sac, while the first and the fourth layer are continuous and they are derived from the greater sac. So out of the 4 layers of the greater omentum, the second and the third are continuous and the first and the fourth layer are continuous. What are the contents in the space between the first and the second layer of the greater omentum? So left and the right gastroepiploic arteries. Greater omentum develops from dorsal mesogastrium. Gastrosplenic ligament develops from anterior part of the dorsal mesogastrium. Anterior and the posterior layers of the gastrosplenic ligament are derived from. So over here the anterior layer of the gastrosplenic ligament is derived from the greater sac, while the posterior layer of the gastrosplenic ligament is derived from the lesser sac. Gastrosplenic ligament connects what? It connects the fundus of the stomach to upper lip of the hilum of the spleen. What are the contents of the gastrosplenic ligament? Gastrosplenic ligament contains short gastric artery and the left gastroepiploic artery. Gastrophrenic ligament is derived from lesser sac. Gastrophrenic ligament connects what? It basically connects the left crus of diaphragm to the cardiac end of the stomach. So gastrosplenic ligament connects the fundus of the stomach to the upper lip of the hilum of the spleen, while the gastrophrenic ligament connects the left crus of diaphragm to the cardiac end of the stomach. Now what are the contents of the gastrophrenic ligament? The gastrophrenic ligament contains left gastric artery and the part of the left suprarenal gland. Stomach develops in which week? It develops in the 4th week. Stomach develops from the foregut. Spleen develops from the foregut in which mesogastrium? Dorsal mesogastrium. Which is the most distensible and the dilated part of the digestive tube? It is stomach. So today up till here, we'll discuss about the further important notes and questions of the further important topics in our next video. Thank you so much.